Hello everyone, I am Dr. Shankar Dey. Welcome to third session of NEET-PG 2022 recall question discussion. So starting with question number 21. So this is question number 21. A patient with hepatomegaly and also with cherry red spot. So cherry red spot and hepatomegaly. What is the diagnosis? Actually this was clinical scenario based question, long question, and the clinical clincher was hepatomegaly and cherry red spot. So what is the diagnosis? So let's discuss about the cherry red spot, in which disease it is seen. So Gaucher's disease, yes, cherry red spot is seen in Gaucher disease, but it is pseudo cherry red spot only in type 2 Gaucher disease. Not all cases of Gaucher's disease show cherry red spot. So this is not the answer. Then Tay-Sachs disease, yes, Tay-Sachs disease, cherry red spot can be seen. Hunter disease, absolutely no. Harler disease, absolutely no. So here the answer is Tay-Sachs disease show cherry red spots. So what is cherry red spots? This is the image of cherry red spots. So this is the image of cherry red spots. See here in this image, here is the presence of cherry red spots in the fundus. So in which disease cherry red spots are seen? This is the popular mnemonic, cherry trees never grow tall in sands. So the mnemonic implies cherry, CRAO, central retinal artery occlusion, T trauma, Niemann-Pick disease, Gaucher disease only type 2, pseudo cherry red spot seen, Tay-Sachs disease and Sandoff disease. So among the option, the question was about Tay-Sachs disease. So the answer is patient with hepatomegaly and cherry red spot, suggestive of here it is Tay-Sachs disease. Next, coming to question number 22, child with recurrent episode of diarrhea. So child with recurrent episode of diarrhea, also steatorrhea, growth failure, HLA-DQ2 positive. So which diet should be avoided in this child? This is typical case presentation of one malabsorption syndrome, that is known as celiac disease or non-tropical sprue. So this is a case of celiac disease. As you all know, celiac disease is a kind of gluten sensitive hypersensitivity. So in this case, the diet that should be avoided is gluten diet. So see my note from e-Gurukul. So those who are interested to prepare for NEET-PG, upcoming NEET-PG, you can install or subscribe the e-Gurukul app. So link given in the description. Download the e-Gurukul app now. Dr. Bhatia Medical Coaching Institute, one of the best institute for PG medical entrance examination preparation. So see here, this is one malabsorption syndrome, celiac disease. What is the pathophysiology? Pathophysiology is, this is kind of malabsorption syndrome, T cell mediated destruction of GI epithelium because of gluten hypersensitivity. So gluten hypersensitivity causes hypersensitivity reaction, and the T cells receptor mediated damage. See here, presence of DQ2. So associated with DQ2, DQ8, it is hypersensitivity gluten hypersensitivity present in Bro structure, BROW. This is the also popular mnemonic. Bro means B for barley, R for rye, O for oats and wheat. So barley, rye, oats, wheats, these foods should be avoided by the person suffering from celiac disease. And antibodies seen, this is also important for upcoming exam. Anti-tissue transglutaminase antibody, most sensitive and most specific is anti-endomysial antibody. Also IgA gliadin antibody seen. On biopsy there will be, see here, this is normal and here this is celiac disease. In case of celiac disease, there will be flattening of the villi or complete loss of villi along with crypt hyperplasia. This is the pathological description. So this is about celiac sprue, beautifully given in the e-Gurukul app 3.0 notes. So coming to question number 23, parasite on microscopy, it was sheath and there was two nuclei at the tip of tail. So what is the parasite that is being described? The parasite is here Brugia. So the parasite is Brugia, not Wuchereria or Loa. Why? See the difference of tail in different parasite. See, first of all, Wuchereria bankrupti. In case of Wuchereria bankrupti, there will be no nuclei and it will be sheath. See, it is sheath without any nuclei. So this is Wuchereria bankrupti. Then Brugia malai. See here, it is also sheath, but here there is presence of two nuclei at the tail end. Then coming to loa, see, in case of loa, it is also sheath, but there is presence of multiple nuclei at tail side. So this is loa, so different, but in this case the question asks about two distinct nuclei at the tip of the tail. So this is nothing but Brugia malai. So this is nothing but Brugia malai. So the answer is here Brugia malai with two nuclei at the tip of the tail with sheath. Next, coming to question number 24, a patient of tuberculosis on ATD, anti-tubercular drugs, history of occasional alcohol intake present, complaining of tingling sensation in the limbs. So this is due to deficiency of which vitamin? So as all of you know, conventional and most commonly used regimen for TB is HRJD, where HRJD stands for isoniazid, rifampicin, pyrizinamide and ethambutol. Here H stands for isoniazid. So isoniazid structurally resembles pyridoxine or vitamin B6. So pyridoxine structurally resembles isoniazid. That's why isoniazid competitively interferes with utilization of pyridoxine and promotes excretion of pyridoxine. That causes pyridoxine deficiency followed by peripheral neuritis. So this is due to deficiency of vitamin B6. So anti-tubercular drug isoniazid causes vitamin B12 deficiency, which causes peripheral neuritis. So answer is vitamin B6 or pyridoxine. That's why during continuation of ATT, prophylactic pyridoxine dose is usually given to all the patient with TB. So coming to question number 25, varicose vein. Following varicose vein surgery, there is loss of sensation from medial aspect of leg. So the question asked from medial aspect. The question asked, so suppose this is the limb, suppose this is right limb. The question asked, this is medial malleolus. So this is, suppose this is patellar bone, this is knee. So one nerve is coming along the medial aspect of the leg like this and supplying also the medial border of the foot. So this nerve is nothing but saphenous nerve, branch of femoral nerve. So during varicose vein surgery, suppose if there lies great saphenous vein, if during varicose vein surgery saphenous nerve can be damaged, and that causes loss of sensation from medial aspect of leg. So the answer here is saphenous nerve. See this beautiful image from Gray's Anatomy. So here see, this is foot and this is the medial aspect of foot. See the nerve, here it is saphenous nerve, medial supplying the medial aspect, and laterally it is supplied by sural nerve. Okay, so medially saphenous nerve, laterally supplied by sural nerve. In this first wave space, that is also important question for upcoming exam, is supplied by deep peroneal nerve. This first wave space, deep peroneal nerve, and this is supplied by common fibular nerve or peroneal nerve. Superficial branch of this is supplied by superficial peroneal nerve. Okay, and the extreme lateral aspect is supplied by sural nerve. So this is all medial aspect saphenous nerve, first wave space. This space is deep peroneal nerve, rest of the foot is superficial branch of superficial peroneal nerve, and lateral aspect is by sural nerve. Okay, and this is medial aspect of thigh by obturator nerve, anterior aspect by femoral nerve, and lateral aspect by lateral cutaneous nerve of thigh. And you can also see here the supply of posterior cutaneous supply of the thigh and leg. So answer here is saphenous nerve is damaged during varicose vein surgery, that may cause loss of sensation for medial aspect of leg. Coming to question number 26, image based question. So as all of you know, this is very popular image, and I think all of you know this is image PUD orange appearance, PUD orange appearance or orange peel appearance. See the skin looks like skin of a orange, so that's why this is known as orange peel appearance or PUD orange appearance. This is seen in patients with breast carcinoma. So patient with breast carcinoma, the question asked I think was, what is the cause behind this breast abnormality? This is because of obstruction of subdermal lymphatics. So breast carcinoma causes obstruction of subdermal lymphatics. Because of this obstruction of subdermal lymphatics, there will be pitting of skin of the breast tissue and looking like skin of a orange. This is called pudis orange. So the cause of this abnormality is obstruction of subdermal lymphatics. Coming to question number 27, farmer after injury presents with varicose plaque with ulcer and discharge. So farmer by profession. So varicose plaque with discharge. On investigation, KOH mount is showing sclerotic bodies or medullary bodies. What is the diagnosis? As all of you know, this is my note from e-Gurukul provided by Dr. Bhatia Medical Coaching Institute. So as you can see here, this is the image of sclerotic bodies, also known as sclerotic body or muriform body or copper penny body or medullary body. So many names for this body: sclerotic or medullary or copper penny bodies or muriform bodies. So synonyms, so many synonyms for this body. So this is one of the type of superficial mycosis known as chromoblastomycosis caused by Phyllophora verrucosa. Okay, so it's pigmented fungi presented with this cutaneous mycosis. So this is nothing but this sclerotic body suggestive of chromoblastomycosis. So answer is chromoblastomycosis. I think in the last NEET they have asked about another question, rose gardener disease, and in this time they had asked chromoblastomycosis. Last time sporotrichosis was asked, this time chromoblastomycosis. Coming to next question, cell to cell communication type is which type? I think the answer is paracrine type, cell to cell communication. Endocrine is through blood vessel. Autocrine means cell influencing his own action, means cell regulating his own action is autocrine, and endocrine is through blood vessels to distant level, and paracrine is adjacent cells influence each other, or communication is by paracrine type. See here, paracrine type signal, this is signaling cell and this is target cell, and their mode of their mechanism is paracrine. A cell targets a nearby cell. Okay, next coming to question number 29, patients with fever, night sweats and cough for 2 weeks. Just seeing these three pictures, don't directly jump to diagnose the case as TB. Read the questions carefully. X-ray showing bilateral hilar lymphadenopathy, bilateral facial weakness. This is because of bilateral 7th cranial nerve palsy with pain in right eye. That may be because of uveitis. So among the following option, which one is the right to cause all the deformities? Answer is sarcoidosis. So in this case, answer will be sarcoidosis, because sarcoidosis can present with granulomatous disease like fever, night sweats, cough. X-ray show bilateral hilar lymphadenopathy. See here, case of sarcoidosis showing bilateral hilar lymphadenopathy. Also it shows right paratracheal lymph node enlargement, as you can see here in the gallium scan. So this is gallium scan showing bilateral hilar lymph node enlargement along with right paratracheal, causing one lambda shaped deformity. So this is also called lambda sign. See here, lambda sign. So bilateral hilar lymphadenopathy with right paratracheal. Also lacrimal, see here, lacrimal glands and salivary glands also showing some signaling. So this is looking like a panda. So this is called as panda sign. So this is panda sign. This is panda sign and this is lambda sign. Okay, clear? Is it clear? So panda sign and lambda sign. Next, panda sign. What is the reason for bilateral facial weakness? Because of 7th cranial nerve palsy caused by granulomatous disease, sarcoidosis. And what is the cause for pain in the right eye? Because sarcoidosis can cause granulomatous uveitis, that may be cause of pain in the eye. So the answer is sarcoidosis. Coming to question number 30, straightforward question. ABG is showing pH 7.2, definitely this is suggestive of acidosis. So first two option is ruled out. This is not alkalosis, this is not alkalosis. So option A is excluded, option A and D. And PCO2 is more, PCO2 more, carbon dioxide retention causing acidosis mean respiratory acidosis, and because of respiratory acidosis there will be compensatory elevation in the bicarbonate. So this is actually compensatory elevation of bicarbonate. This is but pH is still abnormal, so this is partially, I think partially compensated respiratory acidosis. So the question was not complicated, straightforward, very easy question. So this question is respiratory acidosis. The answer is, this is respiratory acidosis, not metabolic. In case of metabolic acidosis, bicarbonate level decreased. So this is all about question number 20 to 32. For more videos related to NEET and for next question 31 to 40, don't forget to subscribe my channel Dr. Shankar Dey. So share the video with your friends, seniors and juniors.